Okay, so let me share my screen. Now we'll talk about the introduction and the methods writing. So regarding the introduction writing, in introduction basically we either write either 4 or 3 paragraphs. No, either 4 or 5 paragraphs. In the first paragraph, we write about the patient's population. For example, I'll be explaining the introduction writing through this particular um, introduction, and it is about congenital heart defects, or sorry, more than congenital heart defects, basically the aortic valve diseases. And for the treatment of aortic valve diseases, basically we use 2 procedures. One procedure is the Ross procedure, and other procedure is the Ozaki procedure, right? It's something about cardiology, but the thing is, my patient population is those with the aortic valve diseases. My intervention is Ross, and my control is Ozaki. These both are something like procedures. Okay, so in the first paragraph, I'll write a bit about my disease. What is my disease? What is its epidemiology? What its is mortality and morbidity rate? And like, for example, let's say that the disease is not that much common, so we'll write sort about its definition, its pathophysiology, its types, and something journal information regarding the this particular thing. So, for example, if I'm writing about the aortic valve disease, so I'll write among congenital heart disease, aortic valve is a common affecting 5 to 6% children with the heart disease. So what I did, I basically wrote its epidemiology, right? And then I'm giving some kind of its like its pathophysiology and some of its like journal information. Valvular aortic stenosis may arise due to dysplastic leaflets, variation in leaflet numbers, abnormal leaflets thickness, and dysmorphic development of the commissurds. So what I am doing, I am basically writing something about my patient population or my disease. So now there are 2 things. Like either if you have a lot of information about the disease, then you people can take the whole first paragraph for your disease. And if, for example, there is like not that much information and something like you don't have to go towards too much generalized thing. For example, if my patient population if type 2 diabetes, then like you people are not supposed to write that type 2 diabetes is this thing. And like you write its whole pathophysiology that it's like in type 2 diabetes, there is insulin resistance, or the pancreas doesn't secrete adequate quantities of insulin, and this and that. Means like type 2 diabetes, everyone knows. You people can write, but the disease which is like too much common, so you don't have to go in that detail. For example, if I'm talking about type 2 diabetes, what I can write? Okay, I can generally explain in 2, 3 lines about the type 2 diabetes, then I have to come to its epidemiology. How many patients died of type 2 diabetes? How many patients are suffering from type 2 diabetes? I can relate it to the age groups. I can relate it to the gender groups that, for example, it affects more male compared to female. It affects Asian compared to Africans. And I'll tell you from where this information we can take. Okay. So you people can give the whole first paragraph to your the patient population group, or if for example if I when I was writing this, so to me this much information was good. After that, the next particular thing which you people have to write is about the past managements. You have to like write what see, like we are comparing our intervention and control thing. This past management is again something of your choice. I'll show you through another example too. But what I'll write in past management is that what was used previously, what were the drawbacks of those past treatments modalities due to which the my intervention and controls were introduced. So For example, now here I am writing that managing congenital aortic valve disease often requires multiple intervention aiming to restore near physiological left ventricular flow outflow while minimizing regurgitation. Despite surgical advancements, now see, I pointed out here that the optimal approach for young children remain debated with valve repair preferred when feasible. Some cases involve that either unrepairable or unlikely modality necessitating valve replacement. So basically now what I am doing, I am explaining the past procedures that valve repair and valve replacement were some of the past procedures, but not, no. Basically, valve repair in this particular case was the past procedure, but it is not feasible. I have written some cases involve valve that are either unrepairable or unlikely to ensure long-term durability. So now I'm coming slowly towards my intervention and control group. Like I am creating a flow in my study that the repair were options, but there are some drawbacks of the repair. Now, this Ross procedure and this Ozaki procedure are basically valve replacement procedures. So, mechanical valve replacement, while effective, is typically a last resort to do due to the need for lifelong anticoagulation and risk of mortality and morbidity. Now, first of all, I explained the valve repair procedure. Then I came towards that, okay, valve replacement is a good option than valve repair. So, now in valve repair, I have the surgical procedure and the mechanical valve repair procedures. For example, now I even wrote the drawback of the mechanical valve repair, that even the mechanical valve repair isn't good to go due to high risk of mortality and morbidity. Now, I come to my intervention group. Now, what I am doing, the first paragraph, I explained two things. I explained the past treatment modalities for my particular patient's group, and I also explained my particular disease or my patient population. So you people have two choices now. Either you can give the whole first paragraph to your patient population, and the second paragraph you people are supposed to write about the past surgical treatments, and then in the third paragraph you have to come towards your intervention and control group. But here I wrote the the past treatment modalities and the patient group in one paragraph. So now in this case, in the second paragraph, I have to come towards my intervention and control group. Now, what I'll do next? In this particular paragraph, I have compared and contrasted my intervention and control group. I wrote about my intervention group, some data about my intervention group, and what I did, I have to write the pros and cons of my intervention and control group. Either you can compare the pros and cons of both these treatments in one paragraph, or you can give the whole one paragraph to intervention group and the next paragraph to the control group, the way I did. First I wrote that the Ross is a gold standard procedure, and like I wrote its pros. I wrote the group points. Now I'm coming towards its drawbacks, but this procedure have certain drawbacks, and like, for example, um, it has a risk of degeneration and reoperation. Additionally, certain condition makes the children unsuitable candidates for Ross procedure. Right now, I'm writing its bad points, its drawbacks. Absolute contraindication include Marfan syndrome and this. Okay, so what I did, I wrote the pros and cons of my control group. The next, I'll write the pros and cons of my in the first I write the pros and cons of my intervention group, and now I'll write the control group things, right? So, for example, this again you'll have to do the same thing. You wrote for the intervention group, then you are writing for the control group. Write its pros and cons. So once this thing is done, you write about the patient population, you write about the past treatment modalities, you write about the intervention and the control groups. Like you have to compare and contrast the two groups in terms of how you are comparing and contrasting that. First you are writing the advantages and disadvantages of first treatment modality, like your first treatment group, the intervention group, and now you are writing the advantages and the disadvantages of your second treatment group, the control group. Once you are done with this, you have to come towards the last paragraph of your study, which is your rationale. Rationale mean what you basically are doing in your meta. So in the rationale, you people have to write your paragraph shall be really good. What you people have to do, you have to write that despite literature is available, like a lot of literature is available on this Ozaki procedures and the Ross group, thousands of researches are done. But now, if you are conducting updated meta, like already meta is done on that particular thing, then what you have to write? You have to write that although meta is done on this particular thing, but let's say if you are updating that, then you have to write that like we have new studies. So we are updating to see like the current to evaluate the current treatment guidelines or the clinical practices to update the clinical practices. It was the past meta. Now we are updating it with the new studies. Like I'm just explaining it in my own words. You people have to write in very good sense, you know. So if you're updating past meta, so you have to write in this sense that okay, literature is available, meta has been done, and even you can write the limitations of that particular meta. For example, let's say any mistake you point out in that meta, anything like for example you are doing grade assessment, for example you are doing the subgroup analysis is something advanced analysis. Let's say the previous meta didn't do subgroup analysis, so it's a strong point with you to okay, you are updating your meta and you are doing subgroup analysis in this meta too. For example, you are doing publication bias, you are doing grade assessment, you are doing tried sequential analysis, you are doing meta regression. So then you have to focus on this thing that, okay, but previous meta was done, but now we have new studies, we have a good sample size, like we have studies with large patient population. So it's necessary to update the meta. And you can write like, we perform um, let's say grade assessment, trial sequential analysis, meta regression, subgroup analysis. Like you have to emphasize what new thing you have done. You have to attract the reader. If you don't have like you didn't write in the introduction or the rationale in that way, then like simply the journal would reject it. They'll say, okay, meta is already done. What's the need for new meta? So you have to emphasize in the rationale because this is my introduction. After introduction, you will write methods. After methods, you will write your results. Then you will write the discussion. So this is your grip point. This rationale paragraph. From here, you will attract the editors and the reviewers that what new you have done in the meta. So if you are updating the past meta, you have to write about the past meta. And you have to cite that particular meta. Like for example, citation is this thing. This you have to cite this meta and below you have to give its reference. Right? Let's say meta is not done and this is novel thing, then what you have to do, you have to say that like if I am explaining for this particular thing, I have done that. Okay, a lot of research has been done for the Okazaki and the Ross procedures, but we don't have any pool analysis. There are conflicting results. One study is saying one thing, other study is saying another thing, and this I already highlighted here. One study is saying that Ross is good, other study is saying that Ross is bad. One study is saying that Ozaki has this particular advantages, but the same study or the other study is saying that, for example, if I'm saying this 11 particular study is saying that Ozaki has this benefits, but this particular study is also saying that it has drawbacks. So what the clinical guidelines have to follow? We don't have any pooled results. So you have to emphasize in the rationale paragraph that although literature is available, but we don't have meta on this particular thing, and it's important to do meta on this thing. For example, I wrote here that given the Ross procedure limitation and Osaki procedure emergent potential, a comparative analysis of pediatric FVT is essential. While the Ross remain a standard, it risk of autograph failure necessitate alternatives, though long-term Ozaki data in children is limited. Therefore, this systematic review and meta-analysis aim to systematically evaluate and compare the outcomes of Ozaki and Ross procedure in pediatric patient population with um, aortic valvular diseases. By pooling current available literature, we seek to provide a comprehensive assessment of clinical outcomes. These findings will offer valuable insights into the durability and effectiveness of these procedures, guiding clinical decision makings for pediatric aortic valve reconstruction. So this is basically your rationale. Even you can write your rationale through ChatGPT. I recommend writing rationale. You have to like give a proper prompt to, for example, you wrote this whole intro, you will copy paste this intro to your chat gpt and you will say that this is my patient population, this is my intervention, this is my control, write my rationale. And you can even give a template. For example, if I send you this template in the groups, you people can directly copy paste this template to chat gpt and say that write on this particular template, but then you have to read. That is that written according to your meta or not? ChatGPT has added or removed something like, for example, if your meta is according to diabetes and you gave this particular template and ChatGPT read Ozeki procedure, so it's obviously wrong. But these words are usually constant, so you have to like utilize these words. This meta-analysis aims to systematically evaluate and compare these particular procedures or systematically evaluate the whole literature, and by pooling current literature we seek to provide a comprehensive analysis. Okay, in the rationale paragraph, one particular thing you people can do, for example, if you people are taking drugs and like the drug has a lot of doses in the studies, but you people selected one particular dose of a drug, then you have to like specify in your rationale that we have utilized this particular dose in the drug, and even you can write its outcomes. Instead of like by pooling analysis, we seek to evaluate the key clinical outcomes. For example, you wrote the key clinical outcomes. Now you know what are your particular outcomes. So you can write the names of two, three main outcomes. And for example, if let's say I am assessing diabetes, and I'm writing its I am assessing semaglutide in diabetes. So my outcomes shall be, let's say, all-cause mortality, decrease in blood glucose levels. So how I will write this? We seek to provide comprehensive assessment of the key clinical outcomes like all-cause mortality, decrease in blood glucose level, weight reduction, etc. So like you people even can give hints of your outcomes here, or it depends on you people. You maybe you don't give, but in rationale, highlight the things which you are doing, the new things which is making your meta strong. For example, if you are updating previous meta and the patient population of the previous meta is less and the patient population of your new meta is more, highlight it in the rationale. If you are doing grade assessment, you are running some kind of advanced statistical techniques or statistical analysis, highlight in the rationale that we are doing this particular things. You are doing publication bias, highlight it in the introduction in this thing. Again, I'll give you a brief overview of the my meta which is published. This is the introduction of my meta-analysis, and what we basically did, we basically compared the transcatheter and surgical aortic valve replacement in chronic liver disease patients. So if I come to its intro, first of all, I explain the my patient population. For example, my patient population in this case is, give me 2 minutes. Okay, so sorry. My patient population are those with aortic valve stenosis in this particular meta, but those having pre-existing liver disease, let's say liver cirrhosis or end-stage liver disease. So now I am writing about the aortic stenosis. That valvular heart disease, particular aortic stenosis is a unique challenge in patients with this particular disease, and then like the whole thing. I explained this already. I wrote about my patient population. I'll share this meta in groups. After that, my intervention group is the transcatheter aortic valve replacement, and my control group is surgical aortic valve replacement. Now, here I am comparing and contrasting my intervention and control groups. I am saying that the traditional modality, basically my control group is the traditional group treatment modality. So the traditional treatment modality for aortic valve replacement is surgical aortic valve replacement. However, this option is highly invasive and poses several challenges for patients with hepatic insufficiency. A more advanced transcatheter aortic valve replacement mediates many of the complications associated with surgical aortic valve replacements in this. Okay, so this was basically I compared and contrasted my intervention and control group. And last, I'll say that these various differences between the surgical and the transcatheter aortic valve replacement have been analyzed by different studies. However, the applicability of these findings is severely reduced by their limitations. Now, for example, I can write the limitations of the studies, not these limitations, but the journal. For example, these are observational studies and their main limitations. By this limitation, I mean that as the studies are saying that, for example, surgical aortic valve replacement is good. The same study will write its drawbacks. Another study is writing about the transcatheter aortic valve replacement, that its advantages. The next like few lines it will write its disadvantages. So basically it's these are their limitations. By pulling data from various studies, this meta-analysis aims to determine whether tower is superior to tower in terms of mortality. Now, I basically, instead of writing in terms of key clinical outcome, I basically wrote my outcomes: mortality, perioperative outcomes, procedural complication, and adverse events. This finding of this analysis will be a cornerstone that guides future clinical practices and assist in identifying the optimal treatment strategies for patients with hepatic insufficiency, liver cirrhosis, end-stage liver disease, or chronic liver disease. So this is all about the introduction. I'll share these both of the intros in the groups. Now, how you will find data? Your patient population you can directly find in the you people can take the data from the your included studies. How you will write, for example, and you people can also take data from Google Scholar and PubMed. For example, I go to Google Scholar. In 2 minutes, I'll show you how I'll write. I go to Google Scholar. I mostly use Google Scholar for PubMed because I directly find. For example, let's say my patient population, let's say this is my patient population, aortic valve stenosis. Aortic valve stenosis is my patient population. I'm writing meta on this. So I'll go to Google Scholar. I'll just simply write aortic valve stenosis. Now I'll scroll around in the articles and find my particular um the lines of my interest which can best suit to my meta. So let's say I won't like write exact the way I am writing here. I'll just show how do I write. And okay. So for example, this is a closed access article. You people can manage the access of the article by going to Sci-Hub. Just copy paste its DOI from here and go to Sci-Hub. This is again closed access article. I don't have enough time now to open the article from Sci-Hub. Most of the data you can find from review articles things. Most of the data you people can find from you review articles. Okay, it's again closed access. I guess I'm finding most of my information from this thing too. So okay, basically my patient population is aortic valve stenosis. Well, let's say I'm not finding any particular data about aortic valve stenosis. Aortic valve stenosis in the current era is a degenerative disease. Aortic valve replacement is only okay. So, for example, I'll write this. What I'll do, I'll just copy this thing, Control plus C. I'll go to either you can go to Google Docs or Word. I go to Google Docs. I open this Google Doc. I paste it here. Okay, now how I will cite? I won't cite this article, this one. I will cite its original article. They even took the article from this and this. So either I can cite both of these or I can cite only one. Let's say I'm just citing the one. Um, I'll directly cite it from here. Control plus C. I'll write a one here, one. This is a rough draft. Once you wrote the whole thing, like the whole introduction, now what you have to do, you can rephrase this thing either manually or you can rephrase this thing through ChatGPT to just Copy this, but copy paste only one line to ChatGPT. Don't copy paste the whole introduction or the whole paragraphs to ChatGPT. It would just mess up with your introduction or your writing. Copy this thing to ChatGPT or any other AI tool and ask it to rephrase this thing. Rephrase in a good words or the way you want to rephrase it. Either you can ask it to check its grammar, you can ask it to rephrase it in a concise way, rephrase it in a okay. Most of the time, if the sentences are too long and I want my data short, so I write rephrase this thing, make it concise, but don't remove any important information. So this is the way I do writing. The next thing is limit the references of your introduction from the minimum limit of your references shall be 7 and the maximum limit shall be 14. Don't like exceed references of your introduction from 14, right? Okay, once the introduction is done, then we'll move on towards the method section. Method is the easiest part of meta. I hope I'm having some methods. Let's find methods in my Google Docs. I usually write methods because it is the easiest thing. Okay, this is my methods. I'll share the template of methods in the group and you people have to simply copy paste this thing. I'll show you from where you have to do changes. The first paragraph of methods is study design and protocol registration. You have to exactly write this thing, but you have to rephrase this thing because this is what I wrote. If you wrote the same thing, it will come under plagiarism. You have to rephrase, like you have to change the word of this particular paragraph uh, either manually or ChatGPT. Okay, so this is basically protocol registration. I'll tell you the protocol registration later once I'm doing Prospero registration and once I register Prospero. Prospero is something where I register my review. The way we do, we take what's it's called? We prepare synopsis in or original studies and we take IRB from our college setups. So in Meta, we basically register our Meta in this at this particular site. In Prospero, assign a particular registration number. It's a 11 or 12 digits number. So we have to write that particular number here. This is about the first paragraph. Exactly the same for all Meta, only the number here is changed. Then search strategy and databases. Which databases you used for making your search strategy? Okay, so databases, I told you people, according to Cochrane guideline, we have to use 3 databases. PubMed is best. Either you can use Embase, Web of Science, Cochrane, Scopus, 3 at least, and you people can use more than 3. For example, in this study, I used these 3 databases. So what I'll write, search strategy and databases. Electronic search was conducted through these databases include available records from inception to May 2025. May 2025 means that what was your last search date? For example, if we are doing these metas, so basically I found these metas in July. Now it's August. I found the metas in the meta topics in July, so I'll write July 2025. With no language restriction, the following keywords or the mesh terms were used. Just take some of the words from your search strategy, right? Some of the keywords from your search strategy and write in this form. Let's say colon polyps, do write in this form. Both sides, sorry. I don't know why it's comma is not placing. Okay, so comma at both ends of particular word. This way you have to write your keywords. And then you have to write that the complementary search strategy is the comprehensive search strategy is available at supplementary file table S1. In that file, you have to copy paste the whole search strategy. So write some of the main words from your search strategy, the main words for your intervention, control, and like patient population groups. Copy paste words from search strategy. Once you are done, then you have to come toward the study selection and eligibility criteria. In this, what you have to do, you have to write exactly the same words. All studies identified through electronic search were imported into Rayan software for screening and duplicates were eliminated. The studies were initially assessed based on their title and abstracts. Full texts were assessed for further evaluation if either reviewers considered the abstract potentially relevant to independent reviewers. Now you have to write in bracket the just the first words of the the first alphabets of the authors. Let's say author is, let's say, Ali Hassan. So what I'll write, A dot A. And let's say this one author is Fatma Salim, let's say. So F dot S. Assess the eligibility of each study based on predefined inclusion criteria. Any disagreement was resolved through discussion and consultation of a third reviewer. U dot A means Umama Alam. So just like hypothetically write the the first and the alphabets of the first and last name of any of the authors from the group or the meta team. So this paragraph shall exactly go this way. Now, studies were met according to the following inclusion criteria. Then you have to write its inclusion criteria. Inclusion criteria, you have to write your PICO. Involve patient with, let's say my patient population is those with colorectal polyps. So involve patients with, let's say if I'm talking about diabetes type 2, then second point shall be your intervention. What is your intervention? Third point is your control group. Fourth is reported at least one relevant outcome. And fifth one is if your people are writing, doing meta on just randomized control trial, you people can explicitly write in your inclusion criteria that your inclusion criteria has RCTs. Then comes the exclusion criteria. And in exclusion criteria, you have to write exactly the same things, these same things. Let's say your patient, all these points shall go the same way instead, except for this observational studies. Let's say you are doing meta on both observational studies and RCTs, then there's no need to write RCTs here and there's no need to write observational studies in the exclusion. Don't write anything. The journal will directly understand that you did meta for both observational studies and RCTs. Once you are done with this thing, so the thing to change in this paragraph is this. Involve patient with this particular thing. Second, you have to write it your intervention and control group and reported at least one relevant outcome. This shall go, this point shall go exactly the same. So the thing to change is only these things. Rest you have to copy paste. Data extraction and outcomes. In this, again, two authors extracted data from included studies into Excel sheet using pre-piloted testes, pre-piloted sheet. Now, once you are done with this, you have to write this thing exactly the same. Here, what you have to do, study characteristics included. Now you have to write about the study characteristics or the baseline characteristics. You have to write just the names of your baseline and study characteristics here. For example, you people extracted data for baseline and study characteristic. Let's say a recruitment period, country, study type, intervention, control, like just the headings, right? Once you are done with writing this, then you have to write what are your primary and secondary outcomes. But then you have to write that the outcomes of this study were categorized into primary and secondary outcomes. And let's say you people have categorized it on the basis of the efficacy and safety outcomes. So you people have to write that the outcomes of this study were categorized based on the efficacy and safety outcomes. Let's say I categorized here in the primary and secondary outcomes. So I'll write that primary outcomes included this and secondary outcome included this. This is up to you. It's your choice which outcomes you keep primary and which outcomes you keep secondary. Basically, the main efficacy outcome, most of the efficacy outcomes always come under the category of primary outcomes, and the safety outcomes come under the category of secondary outcomes. And primary outcomes, we usually keep three or four, not more than these, right? So this was about the data extraction and outcomes. Then comes the quality assessment. I'll be explaining what is the quality assessment thing, but for now, just keep in mind that if you are using randomized control trials, you people have to just copy paste this particular paragraph. And if people are using the Newcastle Ottawa scale, so I'll share that paragraph with you people. You people just copy paste that particular paragraph, right? Certainty of evidence is something, grade assessment. We won't be studying grade assessment here because it's something advanced thing, so skip this thing. Then comes the statistical analysis and sensitivity analysis. In statistical analysis and sensitivity analysis, what you people have to do, you people have to write this paragraph, and this paragraph I'll share. Just copy paste this paragraph. Here you will be explaining the Revman. That Revman the review manager or MN is same thing. And its version 5.5 was used to perform statistical analysis, treatment effect for binary outcomes or excess using risk ratio. And while the continuous outcomes are analyzed using mean difference, you are explaining your analysis, the methods of your analysis, how you did the analysis thing. A p-value of less than 0.05 indicated statistically significant for clinical endpoints. Now, trial sequential analysis wasn't performed. It is something according to me. After this, you people have to write this. If you people have performed sensitivity analysis, so you people have to write the data for sensitivity analysis. If you people haven't performed sensitivity analysis, then there is no need for writing the sensitivity analysis thing. For example, here I didn't perform sensitivity analysis because there was no heterogeneity in my outcome, so I just skipped out that thing. If you people are have performed sensitivity analysis, then you have to write that paragraph. I'll share the template for writing methods and methods thing. So methods is the easiest portion, and you have to write these exact references. Just copy paste these exact references. These shall be copy pasted, right? So once again, this paragraph shall exactly go the same. Here you will put your registration number at the end. So strategy and databases, you just have to change the databases names here and your date and your keywords. So study selection and eligibility criteria, this shall exactly go the same. This paragraph is about the inclusion and this is the exclusion. Inclusion shall go the same. In inclusion, you just have to change your patient population, your intervention and control group. Like you have to specify intervention. Data extraction and outcome, this paragraph shall exactly go the same. And you just have to write the baseline data. Which baseline data you extracted, you just have to write its headings, and in the outcomes, then you have to write that what are your primary, secondary outcomes or efficacy and safety outcomes. Quality assessment, you have to, for RCTs, you have to randomized control trials, you have to copy this thing. And for um, observational studies, we'll be using Newcastle-Ottawa scale. In the next lecture, I'll be explaining the quality assessment thing. Then you people will understand this paragraph. But for now, trust me and just focus that for RCTs, we'll write this paragraph. And for observational studies, I'll share the paragraph in the group. Skip certainty of evidence and statistical analysis, you have to write exactly these same words. I'll share that statistical analysis paragraph 2. There are no changes in the statistical analysis and the quality assessment. You people have to directly copy paste this thing. It's good if you are like aiming to publish your beta in a very good journal, then they check the plagiarism. You people can uh, rephrase once like you are done with writing this thing. For example, if I'm rephrasing the thing, I'll copy this one line first. I'll give ChatGPT and I'll ask it to rephrase to avoid plagiarism. I'll come again and I'll replace this thing with the rephrased paragraph. Then I'll rephrase this thing. Then in chunks I'll replace this particular line. There is nothing to rephrase here because this is what you wrote your key terms. So you people can rephrase the lines which I said that you have to write exactly the same, or it depends on you. If you don't want to rephrase, don't rephrase. But the rephrasing thing I am saying for methods. For introduction, it must that you have to rephrase, because introduction you are taking from article, you are taking from exact like this published study. For example, this method I wrote, this is not published yet. So you people can't, it depends on you people if you don't want to rephrase this, but this thing is um obligatory to rephrase the introduction thing. Results is something, yeah. In results, I left this thing. I just explained the results of the outcomes. So strategy, this paragraph I'll explain once I explain you people the Prisma thing. So basically the whole results is this. First of all, I write results, search results, study characteristics. Study characteristics, let me explain to you people. Basically, in study characteristics, or I'll explain this in another lecture, right? Study characteristics, risk of bias assessment. Once you people are done with risk of bias assessment, you have to write your results and certainty of evidence. Leave for now because you people aren't done with the grade assessment, and then comes to this meta-analysis of primary outcomes. So I wrote the whole results. Then meta-analysis of the secondary outcomes or safety outcomes, I wrote the whole results. So basically, you have to give heading to each outcome and then writes its results. Once the results are done, you have to write the discussion. Discussion section shall be explained in another lecture. This is the whole discussion. Once we are done with the discussion, okay, so this is all about the results and the discussion thing. I hope this is clear. Sorry, the results, production and methods thing. I'll be sharing the whole templates in the group through which I explained.